Pop quiz number 19. A client who's pregnant has developed preeclampsia. She asked the nurse why magnesium sulfate has been prescribed for her. What is the nurse's best response? 1. It prevents hemorrhage. 2. It prevents hypertension. 3. It prevents hypomagnesemia. Or 4. It prevents seizures. And guys, the correct answer is 4. It prevents seizures. If a patient has preeclampsia, we're going to give them that magnesium sulfate to prevent seizures. Now, here's the thing. If you're taking this course, you have a test coming up, most likely you're going to see choice number 2 as a choice. It prevents hypertension. Yes, magnesium sulfate will bring down the blood pressure, but let me tell you something. Magnesium sulfate has so many complications associated with it. It has so many adverse effects. We're never going to give magnesium sulfate to bring down the blood pressure. There's so many better drugs on the market. If we're giving that patient magnesium sulfate, we're giving it so the patient doesn't have seizures. That's why number 4 is the correct answer choice. Let's go through the other choices. 1, it prevents hemorrhage. No, it doesn't. Choice 2 I already talked about. And then choice 3, it prevents hypomagnesemia. Okay, makes sense. Yeah, if you give magnesium sulfate, it most likely will prevent hypomagnesemia. But again, and you guys got to be careful. Just because an answer choice is right doesn't mean it's right for your question. Is it answering your question? The question is telling you that your patient has preeclampsia. Are we really giving magnesium sulfate to a patient with preeclampsia because we're trying to prevent hypomagnesemia? No, because guess what? Hypomagnesemia is not a complication of preeclampsia. But you want to know what is? Yeah, seizures. So we're going to give magnesium sulfate to prevent the seizures, and that's why number 4 is the correct answer choice.